Medicare sounds simple, but it isn't. And most people don't discover that until they have already made a mistake. So let's slow this down and explain what Medicare really is and how it actually works in plain English. First, what is Medicare? Medicare is federal health insurance, but it is not a single plan. That is the first misunderstanding. Medicare is a system, a framework, a set of rules made up of different parts. You are not automatically covered for everything just because you turn 65. Now let's talk about those parts without the alphabet soup confusion. Part A is hospital insurance. It covers things like hospital stays, limited skilled nursing care, and hospice. Most people do not pay a monthly premium for Part A if they work long enough. Many people are enrolled in Part A automatically. Part B is medical insurance. This covers doctors, outpatient care, tests, and procedures. Part B has a monthly premium. This is also where penalties can happen if you delay without having the right type of coverage. Part C is Medicare Advantage. These are plans offered by private insurance companies. They replace Parts A and B and often include extras like dental or vision, but they also come with networks, referrals, and rules you must follow. This is not the same as original Medicare, even though it can sound more attractive on the surface. Part D is prescription drug coverage. This helps pay for medications. Part D is optional, but there is a catch. If you skip it too long, the penalty can last for the rest of your life. This surprises more seniors than almost anything else. Now, here is something very important. Medicare does not automatically do everything for you. Medicare does not choose the right plan for you, warn you before penalties start, stop you from making irreversible mistakes, fix problems later just because you did not know Medicare, assumes you understand the system. Most people do not. That is not a failure. That is reality. This is why Medicare feels so confusing. The rules change depending on whether you are still working. Different parts start at different times. Advice from friends may be completely wrong for your situation, and some decisions can lock you in. Here is the quiet truth most seniors are never told. The biggest Medicare risk is not choosing the wrong plan. The biggest risk is doing nothing, waiting too long, or assuming it will sort itself out. That is where penalties live. Some people want an agent to guide them. Others want to understand Medicare quietly on their own without pressure. That is why MedicareSelfEnroll.com exists. It gives you a self-guided way to understand Medicare and enroll correctly at your own pace without sales pressure. Medicare does not have to be scary, but it does require attention. If you want a calm, pressure-free way to understand your options, you can explore MedicareSelfEnroll.com when you are ready. Please like, share, subscribe, and ring the notification bell so you don't miss our next video.